Thank you for watching the video. This is YouTube Medical University. This video is about the 6 common ways people with depression talk. In fact, many people who are diagnosed with depression have these ways of talking. This is because there are characteristic symptoms in people with depression, and these characteristics appear in their way of talking. Most of the time, people with depression are not aware of it themselves. In fact, even if you are being treated at an outpatient clinic, there are people who are actually progressing with treatment who are depressed. If you thought you couldn't go to work because of fatigue, you were depressed. This happens quite often. The way you or someone important around you talks may actually be a symptom of depression. If you can notice it earlier, I made this video for such people. By watching this video to the end, you will not only learn about the characteristics of how people with depression talk, but also about the symptoms of depression based on diagnostic criteria. And in the second half of the video, there are 2 simple questions to check if you have depression. And at the end of the video, I want to tell you what I really think is important in treating it. So please watch until the end. So today, I will first introduce the 6 characteristics of how people with depression often talk. In the second part, there are 2 questions to determine if you have depression. And in the third part, I will explain the important things you should know about depression. At YouTube Medical University, we discuss becoming healthy and talk about disease prevention and early symptoms that aren't discussed in outpatient clinics. Subscribe to the channel to not miss new videos. Let's begin with the 6 characteristics of how people with depression frequently speak. Saying "I'm fine" often becomes a habit. Even when asked, "You don't seem well lately, are you okay?" people tend to reply, "I'm fine, just a bit tired." You likely know someone like that. As mentioned earlier, with depression, people around you often notice it before you do. That's how it usually happens. You may feel slightly tired and overworked, but to others, you might seem extremely exhausted. This could also indicate depression. People with depression often force themselves to say they're okay because they don't want to worry those around them, and often they end up taking a leave of absence from work because they realize from the situation at work that they're not okay, and no one can fill that gap. Most people are in a situation where they have no choice but to say they're okay even when they're told they're okay. Therefore, instead of asking if they're okay, those around them should. There are also people who can't help but answer "I'm okay" when asked if they're okay. So when you're worried about someone, start by discussing their living conditions. Ask them casually about things like whether they're eating properly, sleeping well, or able to enjoy their hobbies. If you're worried about someone, encourage them to see a specialist, suggest they leave work early, or advocate for them to take a break to their boss. These are the actions that are needed. One of the things that people with depression often do is change the way they talk. The second is that their rhythm gets disrupted. You might wonder what the connection is between depression and disrupted rhythm. People whose way of speaking suddenly changes are actually quite common. When you become depressed, losing motivation, feeling down, having a reduced appetite, and experiencing sleep issues, particularly insomnia, are common symptoms. Early morning awakening is a characteristic sign of insomnia associated with these symptoms. Insomnia keeps you awake at night, and when you finally drift off, you wake up early and can't fall back asleep. This leads to daytime sleepiness even during work or chores, but you still can't sleep at night. It becomes a vicious cycle. In fact, it's said that the concentration of people who are sleep deprived is the same as that of people who are drunk. There are people who, due to lack of sleep, become unable to function as if they were drunk. In reality, there are people who are told by their superiors to speak more clearly, even though they think they are speaking clearly. They start to wonder if their way of speaking is strange and lose confidence. There are also people who tend to cry a lot, which is a characteristic of people with depression. In fact, there are people who start to cry uncontrollably while talking in the consultation room. Just receiving a little attention from family or colleagues can suddenly bring on tears, even when you're not usually a crier. These symptoms are different from the way of speaking, but they are characteristic of people with depression. When I see such a crying spell, I think to myself, I think these physical symptoms are a sign from the heart, even though the rational part of my brain tells me to do more. Even though I want to push myself, I can't go beyond a certain point of stress. My heart is already at its limit. As a result, physical symptoms appear. Tears flow, palpitations occur, hands tremble. These symptoms appear. Even if my head tells me to push on, if my heart and body are pushed any further, it could lead to serious problems. If I don't stop pushing and rest, such symptoms may appear as an save our souls sign. If someone around you is crying more than usual, they might be depressed. Approach them with a willingness to listen. People with depression often speak in a rushed manner, using filler words like so, like, and sorry. Don't rush them, as they don't speak at a relaxed pace. Actually, this symptom of being constantly anxious and unable to organize thoughts could also be a symptom of depression. Symptoms of depression include feelings of anxiety and a decrease in concentration. Feeling anxious for no particular reason, feeling restless, feeling tense and stressed, these feelings persist, and these symptoms manifest as actions. Sitting or standing, the restlessness is unbearable. Moving your hands, suddenly standing up and starting to move, these are the symptoms. Furthermore, the concentration decreases, so even though you're anxious, the words don't come together. That's why you say and that. While being anxious, you keep talking and can't put your words together. There are people who end up talking like this. This is a characteristic way of speaking that people with depression often do. The fourth characteristic is that the words become intermittent. From these characteristics in this project, putting the customer first. I was just about to gather my thoughts and make another announcement when suddenly my thoughts stopped and I couldn't get the next words out. This is also a characteristic symptom of depression. We call it psychomotor retardation. It's a difficult term, but it's simple. The way you talk and move becomes slower than usual. That's a characteristic. And there are other factors as well in the characteristics of people with depression. There's also something called microdelusions. Microdelusions are symptoms where you undervalue yourself more than reality, thinking negatively like, I'm a worthless person, and you can't feel the value in various things other than yourself, and you end up not feeling your own value. There are people like that. When that happens, even while having a conversation with someone, you think, it's inexcusable to use their time for me. I'm worthless, and end up not being able to gather your thoughts, or the conversation gets cut off. People around may misunderstand that this person doesn't want to do anything, and it can cause even more distress. There are also people who seem to lack confidence and motivation because their words are often cut off. It's possible that these are symptoms of depression. I would be happy if you could remember that. The sixth characteristic of how people with depression talk. The fifth one is this. Either is fine, but it becomes a verbal tic. When a friend asks what to eat tonight, you might say, anything is fine. Or at work, when asked, do you want to take a break first? Or do you want to finish the rest and then take a break? You might say, either is fine. There are people who often say either is fine. This is also common among people with depression. This verbal tic is really because the person thinks either is fine. It's not that they don't care, but their concentration, decision-making abilities, and motivation may have declined due to depression. This makes it difficult to think quickly and make decisions, leading them to say either is fine. If they really try to think about it, it takes a lot of time, and they feel it's not worth spending that much time, so they end up leaving the decision to the other person by saying either is fine. However, such behavior can be misunderstood as, they're not interested in me, they're not enjoying it at all, and so on. This can lead to troubles between spouses or friends, and is a common issue that often comes up in the national examination for medical students specializing in mental health. The issue is that people with depression cannot make important decisions. Depression is, in a nutshell, a disease of the brain. They may make important decisions that they would never make otherwise, such as deciding to quit their job, impulsively moving to a different area, and in the worst case scenario, they may even consider disappearing from this world, with their thoughts easily turning to such extremes. This is a hallmark of depression. When interacting with someone with depression, it's important to avoid forcing them to make any decisions. Even if it's something as light-hearted as asking if they have a place they want to go for their next vacation, or if there's something they want to eat, it could potentially be a burden for them. So please be mindful of this. This is a common characteristic of how people with depression communicate. Here comes the sixth selection. I'm worried that the number of dropouts might increase. I'm sorry, but would it be okay if we cancel today's schedule a bit? I'm not feeling well. I end up cancelling plans at the last minute, saying things like, I'm not okay, don't push yourself. This is becoming more common. One of the main symptoms of depression is a loss of interest or desire, and on top of that, there's an indescribable fatigue as if you're carrying a heavy weight. There are many patients who describe this kind of heaviness in their body. However, people with depression also want to enjoy their daily lives as normal, and there's no doubt that it's better for them to get out of the house and refresh themselves. They may put on a brave face in front of their friends and accept invitations, but when they get home and think about it, their body feels too heavy to consider going out on their day off. Even if they do go, they can't enjoy it at all. There's no doubt that it will make them feel worse, so they end up cancelling plans at the last minute. This kind of thing happens. As the symptoms progress, they may even start to decline invitations altogether. But for people with depression, even declining an invitation can be a burden. If you see someone who is down, don't just invite them out for fun or for a drink. Support them in doing what they have decided they want to do on their own. Show them that kind of attitude. Please take care of your heart. How did your recovery go? People with depression are often good at expressing themselves. The first thing to note is that it's okay to become a mouth ulcer. The second is that the rhythm doesn't go around. The third is that they talk while burning. The fourth is that the words become intermittent. It's common for mouth ulcers to appear anywhere and for the frequency of dotakans to increase. These are some typical characteristics. The way of speaking is based on the symptoms of the diagnostic criteria of a disease called Diagnostic and Statistical Manual of Mental Disorders, 5th edition, and I introduced it, including my own experience, definitely. Just because you hit it doesn't mean you're always depressed, and just because you don't hit it doesn't mean you're not depressed, so be careful not to decide. I think if you could. So in reality, if you hit the symptoms, the possibility of depression goes up or down. I will introduce 2 questions to check for depression in the second limit. There are 2 major symptoms of depression. Screening whether or not these 2 symptoms exist is called a 2-question method. Please answer yes if you often have such symptoms for a month in response to the 2 questions we will ask from now on, and no if you don't. Let's go. Have you often felt depressed or gloomy for a month? The second one is this month. Have you often found that you can't enjoy things from the heart or lose interest in them? If neither of these 2 questions apply to you, say so. If neither applies to you, the likelihood of depression decreases. On the other hand, if either of the 2 applies to you, the likelihood of depression slightly increases. So please listen to whether the 7 symptoms we will ask about later also apply to you. If one or more of the 2 questions asked earlier apply to you, we will introduce the following. If 4 or more of the 7 questions apply to you, you may be depressed. The likelihood of depression increases, so we recommend that you get a diagnosis from a nearby family doctor or a specialist in psychiatry. The first symptom is a decrease in appetite. You always have a decreased appetite, and even though you're not trying to lose weight, your weight has decreased. The second symptom is sleep disturbance, causing difficulty sleeping well each night. You wake up in the middle of the night or wake up early in the morning and can't go back to sleep. The third symptom is cessation of mental activity or anxiety. Your speech and actions are always slower. Words don't come out easily, or on the contrary, you can't sit still and are restless. The fourth symptom is fatigue or lack of energy. You're always tired, can't get in the mood, your body feels heavy, and it takes time to do everyday things. The fifth symptom is a sense of guilt. You feel like you're a worthless person. You blame yourself for doing something wrong. You think that things aren't going well because of you. The sixth symptom is reduced concentration and cognition. You struggle to focus, your thinking is slower, and your thoughts are scattered. Even when you watch the news or television, the content doesn't sink in. The seventh symptom is suicidal thoughts. You feel so depressed that you want to disappear from this world, and you've actually planned it. How are you doing? If you have 4 or more of these 7 questions at the same time for 2 weeks, the likelihood of depression increases. I hope this will be helpful. Of course, it's important to note that you can't diagnose depression with just these questions. There are many processes until diagnosis, such as examination by a specialist or exclusion of other diseases, such as bipolar disorder. Just because you don't fit these questions doesn't mean you're not depressed. There are many things you may not notice yourself. If you're worried or if you fit, please consider seeing a specialist or your family doctor. So let's check the disease in the next review. 2 questions as a 2-question method. Have you often felt down or depressed for a month? Or have you not been able to enjoy things or lack motivation? I introduced the method of asking whether there are symptoms, and then, as 7 questions after that, decreased appetite, insomnia, concentration, or anxiety are diagnostic criteria for the disease. I introduced 7 more questions. It's been a long time, so I'd be happy if you could listen to it over and over again while taking notes. Finally, I would like to explain my thoughts, which I learned while actually treating people with depression in my third limit. Depression is actually a very common disease. It is said that 10% of people will suffer from depression in their lifetime. The possibility that you or someone around you will suffer from depression in your lifetime is not low. There are many people who have lost hope in life, lost their jobs, and are in despair because they have become depressed. What I want to say here is that depression is not something that happens because the heart is weak. It is not a weakness of the heart. Depression is a disease of the brain that is weak. Various researches are being conducted and the cause of depression is gradually being clarified. It is not because your heart is weak. Just as you restrain your diet to rest your intestines when you have gastritis, I think it's important to be aware of resting your brain when you have a brain disease. And the trigger for becoming depressed, a brain disease, is often the onset of stress due to a mismatch with the surrounding environment. It can be considered as the early stage of depression. There is also a disease called adaptation disorder, but those who become depressed are not able to adapt to their surroundings, not because they are weak. I hope you don't think that way, and I hope those who are misunderstood will change their thinking. I think of adaptation disorder and depression as allergic reactions of the mind. Just because someone has a fruit allergy doesn't mean they're weak and can't adapt to fruit. In other words, just as there are times when certain fruits don't agree with you among all the different foods, there are times when you become depressed because you're carrying stress. Sometimes your workplace or your friends are the allergies that don't agree with you. I don't want you to think that there's something wrong with your humanity or that your heart is weak. If you've listened to this video and felt even a little bit anxious, or if you've thought that it might apply to you, the first thing I want to tell you is to take a good rest. If you're in a situation where you can't rest immediately, reach out to your supportive family or friends. It's okay to talk to anyone around you, like your boss. If you don't have anyone to lean on, consider getting a diagnosis first, as stated in the summary section. It's okay to consult with telephone support for mental health. If necessary, go to a hospital, get a diagnosis, and receive the necessary treatment. This kind of approach is important. You can't just think that things will work out depending on your mood. Please ensure those around you don't share that view. I've previously discussed adaptation disorder in past videos, which you can watch later from the summary section if interested. This time, I talked about the 6 characteristics of the way people with depression often speak. While touching on the way of speaking, we learned the diagnostic criteria for depression, how to check whether it's depression, and I shared what I think is important. Like this, at YouTube Medical University, we are broadcasting information that is useful for health from a doctor's standpoint with responsibility. In a world flooded with information, I believe it is very important to have a reliable source of information. If you like, it would be encouraging if you could register for the channel. And it's okay to press the good button or the bad button, so please rate this video. Also, sharing your thoughts and what happened around you in the comments, which I think is very important, will be a reference for others, so I would appreciate it. Well then again. In the next video, I, a general practitioner, will share the secrets to living without aging from your 70s onward as learned from my patients. I became the bestseller and ranked first in the gift ranking at Amazon's 4 departments. I have compiled into one book the important ways of life and health methods that I learned from my patients while working as a regular doctor. It has become a book that makes me think I want to live healthily in this way. It's selling very well, so please check it out.